Welcome to the Deep Dive, where we cut through the noise to bring you the most potent, data-driven insights. Today, we're diving into a profoundly important and frankly challenging topic, the persistent epidemic of homicides in Baltimore City. It's really not just a story about crime numbers, it's a complex tapestry, social, economic, historical threads all woven together. Our journey into this landscape is guided by a really powerful dissertation. It's titled Use of Epidemiological and Geostatistical Methods to Understand the Epidemic of Homicides in Baltimore, 2005 to 2017. It's by Renee F. Najera from Johns Hopkins University. And let me tell you, this isn't just some dry academic paper. It's a deep, data-rich exploration into how a city grapples with, well, pervasive violence. So our mission today is to unpack these complex layers behind Baltimore's elevated homicide rates. We want to understand the who, the where, and crucially explore potential pathways forward. We're essentially treating violence here not just as a crime issue, but as a public health crisis, something that can be mapped, understood, and, ultimately intervened upon.
And that public health lens is precisely what's so significant here. It really shifts the perspective. The World Health Organization recognizes violence as a public health problem, right?
Right.
And adopting this framework lets us study its patterns, its clustering, its spread, even its potential for transmission, much like we would with an infectious disease. This quantifiable approach, it moves us beyond just anecdotes. It gives us the hard data needed to inform targeted, evidence-based interventions.
Okay, let's unpack this with a stark reality. The research highlights that Baltimore has faced homicide rates several times higher than the U.S. average since at least 1975. That's a long time.
A very long time.
And since 2015, the city has been in the grip of what the study calls a clear epidemic. The average rate climbed to over 50 homicides per 100,000 residents. That's a staggering number. It just demands a deep, data-driven understanding. To really get a handle on the current situation, we kind of need to look at the historical context. FBI figures show Baltimore's homicide rates have consistently been way up there, above 30 per 100,000 since 1986. They even peaked above 40 back in the 1990s. Now, there was a notable dip around 2011. The city recorded 196 homicides then, which is about 32 per 100,000, a low they hadn't seen since, 1978?
Yeah, exactly. But what's truly fascinating and quite alarming is the sudden sharp pivot we see starting in 2015. From that 2011 low, homicides just soared. 342 in 2015, that's 55 per 100,000. Then it reached a historical high of 343 in 2017, so 56 per 100,000. This drastic shift, it almost felt like overnight, from a relative decline to these epidemic levels. That's the core puzzle this dissertation really tries to unravel.
And the timing of this dramatic spike is just critically important, isn't it?
Absolutely.
It clearly coincides with the Freddie Gray riots in April 2015. After Mr. Gray's death, tensions just escalated. There was widespread unrest. Homicides jumped to 22 in April alone. And then an unprecedented 43 homicides in May of that year.
A huge jump in just 1 month.
Yeah. And the study also presents this striking correlation that helps explain this shift, or at least part of it. There's a clear spike in homicides that happened alongside a significant reduction in police arrests. So in 2014, the Baltimore Police Department made over 46,000 arrests.
Okay.
That number plummeted to under 33,000 in 2015, and then it dropped further to just over 24,000 in 2017. And compounding this, the BPD also saw a reduction of about 360 officers between 2015 and mid-2016.
Right. And this phenomenon, it aligns with what some people call the Ferguson effect,
Right.
which is basically the idea that police might scale back proactive operations when they're under intense public scrutiny or, after a major incident.
Right. The scrutiny was definitely intense.
Extremely. And Baltimore's situation was further complicated by that federal consent decree in 2017. The DOJ finding found a, quote, systemic and persistent culture of violating civil rights within the BPD.
A very serious finding.
Very. And then adding another layer, also in 2017, 8 members of the gun trace task force were indicted for racketeering and fraud. So the dissertation suggests these factors combined created an environment where that crucial balance between guardians and motivated offenders, as routine activities theory puts it, may have significantly shifted.
It sounds like a confluence of really major events impacting policing and potentially the violence levels.
Precisely.
Beyond these sort of social and policy shifts, the numbers also reveal a clear seasonality to the violence. Did you find that interesting?
Yeah, that was quite noticeable.
Homicides peaked in the warmer months, May and July, averaging about 26 per month, and they were lowest in February, averaging around 14 per month.
Which hints at environmental factors, doesn't it? Like
Right.
simply warmer weather allows for more outdoor interactions, more potential conflict points, perhaps.
It makes sense. Okay, so here's where the dissertation gets into the human element, revealing this deeply troubling portrait of who is most vulnerable. The study reveals these stark disparities. African American men between 15 and 34 years old.
hmm They comprised over 61% of homicide victims in Baltimore between 2005 and 2017. 61%. But they're only about 30% of the population.
That's a critical demographic insight, just incredibly disproportionate. And not only did African American males consistently have the highest homicide rate, but they also showed the sharpest, most dramatic increase during this epidemic period. Their rate jumped from 956 per 100,000 residents in 2014.
Which is already high.
Already incredibly high, yes, to a staggering 1,672 in 2015. Now, while white males also saw an increase, it was from a much, much lower baseline. It just highlights this profound and, frankly, growing inequity.
So delving deeper into victim characteristics, the study paints an even clearer picture. The average victim was young, around 30 years old. Male victims generally younger than females. And African American victims were younger, on average, than non-African American victims.
Right.
When it comes to education, the data offers a really stark, actionable insight here. Higher education seems to be a powerful shield against victimization.
It really does seem that way. Nearly 4 in 10 adult victims hadn't completed high school. And listen to this. Not a single victim identified in the study had a graduate degree.
Wow.
It just underscores education as a critical, maybe long-term intervention point.
Definitely something to focus on for prevention.
Now, about 68% of victims were employed. That figure was pretty consistent across demographics, although employed victims did have a slightly higher likelihood of being white.
Okay.
Interestingly, toxicology reports, they showed that while substance use was prevalent, victims with alcohol detected were significantly less likely to be killed by firearms.
Huh. That's counterintuitive, perhaps.
It seems so. It doesn't mean alcohol is protective, obviously, but it might point to different contexts or risk factors depending on the substance involved, maybe different types of confrontations.
That's plausible. Something worth exploring further.
Marriage also appeared to be a protective factor.
Mhm.
About 74% of adult victims were reported as never married.
Mm.
And a striking 85% of homicides occurred away from home. Though victims killed at home were more likely to be female, white, or victims of intimate partner violence.
Which connects to the next point, right? Intimate partner violence.
Exactly. IPV accounted for 3% of victims overall, but females were a staggering 25 times more likely to be IPV victims than males.
25 times. That's huge.
It really is. And finally, the cause of death. An overwhelming 83% of all homicides were by firearm.
Right.
That number actually increased to 86% during the epidemic period. And males were nearly 5 times more likely to be firearm homicide victims.
So firearms are just central to this epidemic.
Undeniably. So what's the key takeaway from this detailed profile for you, the listener? The average victim is an African American male aged 15 to 34, typically with a high school education, employed, killed by a firearm, usually away from home, and often with substances detected in toxicology.
And this isn't just a list of statistics. It's a specific, actionable profile. It helps us think about how to tailor interventions with much more precision.
Exactly. Okay, so if that's the deeply troubling portrait of who is most vulnerable, let's map out where this epidemic is concentrated.
Right. The spatial component.
The study makes it crystal clear. Homicides are not equally distributed across Baltimore's 55 community statistical areas, the CSAs.
No, definitely not. And this is where that concept, deviant places theory, becomes really relevant. It highlights how the environment itself, the place, can contribute to crime. The study found homicides clustered around CSAs with elevated levels of poverty and visible physical disorder.
Physical disorder like?
Think broken streetlights, vacant housing, abandoned cars, that sort of thing. It really underscores that it's not just about individuals, but also the places themselves and the conditions within them.
And the data strongly supports this, right?
Absolutely. The 18 poorest CSAs accounted for a staggering 50%, half of all homicides between 2005 and 2017.
Half the homicides in about a third of the areas.
Exactly. While the 18 wealthiest CSAs, they accounted for only 10%. It speaks volumes about inequality.
Wow. And the study used specific statistical methods to analyze this.
Yes. To ensure the findings were robust, they used something called negative binomial regression. It's good for counting events like homicides, which are relatively rare overall, but cluster in certain areas. And what it revealed was striking. For every 10% increase in households below the poverty line in a CSA, There was a 21% increase in homicides.
21%.
And even more dramatically, for every 1 unit increase in that physical disorder index we talked about, there was a 47% increase in homicides.
47%, that's huge. It suggests fixing up neighborhoods might actually save lives.
That's certainly one implication, yes. The environment matters.
So the geographic analysis identified specific hotspots.
It did. 2 large, persistent hotspots, areas where homicide counts consistently clustered over the years, were found in East and West Baltimore. Then there were smaller, persistent hotspots in Northwest Baltimore: Bel Air, Edison, Brooklyn, Curtis Bay, Hawkins Point, Cherry Hill, and Forest Park, Walbrook. The analysis also highlighted areas where things were getting worse during the epidemic. Intensifying hotspots in Upton Druid Heights and Sandtown, Winchester, Harlem Park, and new hotspots, places that weren't previously hotspots but became so during the epidemic in Greater Delvins, and, again, Brooklyn, Curtis Bay, Hawkins Point.
But here's something that jumped out at me, a truly surprising and maybe hopeful finding. Cherry Hill.
Yes, that was notable.
It previously had a hotspot, but the analysis showed a vanished hotspot during the epidemic period. And this coincided with Cherry Hill having the largest decline in its yearly homicide rate across the whole city.
It strongly suggests that whatever interventions or changes were happening there,
Yeah.
something was working. Something positive was going on.
We need to know what that was.
Absolutely. It warrants further investigation.
On a more sobering note, though, the proximity to schools. Over a third of all homicides occurred within the 1,000 feet of public schools. And one elementary middle school, located in Sandtown, Winchester, Harlem Park, had 33 homicides within that immediate buffer zone, 29 of them by firearm.
That's deeply concerning. Highlights the environment children are growing up in some areas.
It really does. Now, you mentioned something earlier about how geographic data is analyzed,
Yes, the modifiable aerial unit problem, or MAUP. It's a crucial statistical nuance to keep in mind. Essentially, it means that how we draw the lines on a map, how we define a neighborhood or a buffer zone, can actually change the results we get from our data.
So the boundaries matter.
They matter quite a bit. It's just a reminder that while these spatial models are powerful tools, they're statistical representations, not absolute ground truth. Our interpretation needs to be careful. And also, while poverty and physical disorder are clearly significant drivers, they might not be the only community-level factors at play.
Like what else?
Well, the opioid epidemic, for instance, was raging during part of this period. That could certainly interact with and contribute to violence levels in complex ways, not fully captured by just poverty and disorder metrics.
That makes sense. A lot of interconnected issues.
Definitely.
The study also looked at how far victims travel from home, right?
It did. On average, victims were killed just under 2 miles from their residence, about 1.95 miles.
And that didn't vary much based on who they were.
No, there was no statistically significant association found with the victim's age, race, gender, or cause of death. This finding that homicides often occur away from home has important implications for thinking about both person-based and place-based interventions.
Right. Okay, so moving from understanding the problem, the who and the where, to exploring solutions, what actionable blueprint emerges from this dissertation?
Well, the study explores a whole range of interventions, coordinated by both government agencies and civil society groups.
Let's start with the government side. The mayor's office launched these violence reduction zones. What was the key idea there?
The key insight seems to be a whole-of-government approach, taking small, really troubled areas and flooding them, so to speak, with a complete suite of services.
Not just policing.
Not just policing, no. Increased police presence, yes, but also trash cleanup, housing inspections, extended rec center hours, job training, needle exchanges. It's about trying to achieve a kind of holistic community uplift.
Okay. And then there was Dating Matters.
Right, a program from the Baltimore City Health Department, the BCHD, aimed at younger kids, 11 to 14-year-olds, trying to prevent dating violence before it starts.
And maybe one of the most widely known interventions is Safe Streets.
Yes, also overseen by the BCHD. This program adapts the cure violence model, which, as we discussed, directly treats violence like an infectious disease. It employs outreach workers, often folks who are formerly incarcerated and have deep community ties, street cred, you could say.
Right.
And their job is to mediate conflicts before they turn violent, offer help with job searches, connect people to drug treatment.
Where did this operate?
It operated in several key areas identified in the study, like Cherry Hill, Mondawmin, Park Heights. It later expanded to Sandtown, Winchester, too.
And how effective was it?
Well, a 2012 report showed kind of mixed results, but later mayoral administrations have really touted its successes. So the evaluation picture is a bit complex.
Okay. And the BPD itself, what interventions were they doing?
They engage in community policing efforts, foot patrols, youth engagement activities, also hotspot policing, using data and technology to direct patrols. Though it's worth noting, a previously successful but controversial unit, the Violent Crime Impact Section, was disbanded due to complaints of misconduct, which just highlights the constant tension and complexity in these efforts.
Yeah, that balance is tricky.
And finally, on the government side, there's the expanded school mental health program, offering vital services like counseling and referrals in over 100 schools.
That seems crucial given the trauma exposure.
Absolutely.
What about civil society, non-government groups?
Incredibly active as well. Johns Hopkins Medicine, for instance, runs a summer jobs program. They offer 8-week internships to city school students interested in medical fields.
Does that help with violence?
Well, studies in other cities have shown that similar youth employment programs can significantly reduce involvement in violent crime. It provides structure, income, positive role models.
Makes sense.
The University of Maryland Medical Center, UMMC, also has several really impactful violence prevention initiatives. One is their Violence Intervention Project. They identify violence victims right there in the emergency department and offer critical services to try and prevent re-victimization.
Breaking the cycle.
Exactly. They also have the Bridge program, which specifically helps domestic violence victims with crisis intervention, advocacy, counseling, and a school youth partnership, mentoring young people, trying to guide them away from risky behaviors.
And then there are community groups.
Lots of them. Baltimore Ceasefire 365 is one, working to reduce gun violence through awareness campaigns, those ceasefire weekends you hear about. Groups like Friend of a Friend mentor individuals while they're still in correctional facilities. Strong City Baltimore, Park Heights Renaissance, the East Baltimore Community Corporation, they all focus on broader community revitalization. Things like education, economic opportunities, drug treatment access. It's a wide net.
So when evaluating all these different programs, did the dissertation offer any kind of framework?
It did. It proposed a rating system based on several factors, like is the program located in a hotspot? Is it aimed at a high-risk group? Is it equitable? Is there evidence it's effective? Is it designed for the long term?
And any standouts based on that?
Safe Streets received the highest preliminary rating based on that framework. But what's really crucial to highlight, I think, are those UMMC programs, the hospital-based ones, because they're critical for secondary and tertiary prevention.
Meaning preventing repeat victimization.
Exactly. Victims of violence are, unfortunately, at a significantly increased risk of being victimized again. So these hospital-based interventions are vital for breaking that cycle and preventing further harm.
It's clear that many of these interventions, both government and civil society, really emphasize youth and specific hotspots. That lines up directly with the who and where findings we discussed.
It does. There seems to be an alignment there.
The dissertation also maybe implicitly touches on that significant racial wealth divide in Baltimore, which suggests that equitable economic development, not just, gentrification that pushes poor residents out, has to be part of the solution, right?
Absolutely essential. Any solution has to consider how economic improvements impact the residents already living in these vulnerable areas. Do they benefit or are they displaced?
That's a key question. So building on all that, the dissertation offers some pretty clear, actionable recommendations, doesn't it? Grouped by person and place.
Yes, it does. For the person, the recommendations are quite specific. Interventions should strategically focus on African American men aged 15 to 35, given their huge, disproportionate victimization rate.
Targeted support.
Exactly. There's also a call to expand intimate partner violence education, not just for teens, but also for adult men, and considering how economic pressures might exacerbate those dynamics. Another point is expanding the existing child fatality review process to include other vulnerable adults like the elderly or those with severe mental illness. This could help close critical data gaps, though we understand risk is better for those groups too.
Better data, better interventions.
Precisely. And as we just discussed, expanding those hospital-based violence intervention programs to all emergency departments. Making that standard practice seems key to interrupting the cycle of re-victimization.
Okay, so those are the person recommendations. What about place?
For the place, equitable and sustained economic improvement in those poor CSAs is paramount. The emphasis is on ensuring existing residents truly benefit, not just seeing the neighborhood change around them.
Community wealth building, maybe?
Something like that, yes. Also, enhancing community policing. The goal is fostering timely, common, and amicable interactions between officers and citizens, building trust. especially crucial in those emerging hotspots.
Building bridges, not barriers.
Right. The recommendation also suggests gradually expanding the Safe Streets program into those emerging hotspots, making sure to incorporate community needs into how it operates, and maybe even bringing it into schools for conflict resolution training.
Proactive prevention.
Yes. And finally, making that violence reduction zones program, the one with the wraparound services, permanent and mobile, so it can be deployed strategically as needed, adapting to shifting patterns of violence.
That seems logical. We can also learn from successes elsewhere, right? The study mentioned other cities.
It did. New York City, for example, attributes its record low violent crime numbers, at least in part, to a combination of sustained economic improvement and evolving effective policing practices over many years.
A long-term approach.
Yes. Oakland, California, adopted multifaceted efforts. Neighborhood crime prevention councils, strategic data sharing between agencies, robust monitoring of parolees, and comprehensive services for at-risk individuals. Chicago has leveraged predictive policing. They have successful summer jobs programs for youth, like the Hopkins one here. And they also use their own version of the Cure Violence model called Project Safe Neighborhoods, which has shown effectiveness.
So there are models out there, things that seem to work.
There are. But through all these potential solutions, the dissertation stresses one absolutely critical factor: stakeholder buy-in.
Meaning the community has to be on board.
Exactly. For any intervention to truly succeed, it must be championed by and deeply integrated with members of the targeted population. If communities don't feel invested, or if they distrust the institutions providing the help, even the most well-designed program is, frankly, unlikely to be effective long-term.
It needs to be a partnership.
A true collaboration, not something just imposed from the outside. That's key.
Wow. Okay, so this deep dive into Baltimore's homicide epidemic really reveals this incredibly complex interplay. Individual characteristics, environmental factors, deep historical context, all significantly compounded by specific events like the Freddie Gray riots. It's a stark reminder, isn't it, of the systemic challenges facing not just Baltimore, but many of our cities.
Absolutely. And while the statistics are stark and the human cost is just immeasurable, Najira's dissertation provides a really robust, data-driven framework for understanding this crisis. And crucially, it offers concrete, actionable pathways for intervention. It's not just describing the problem. It gives us tangible areas to focus our efforts, from individual support systems to neighborhood-level revitalization to evolving police and community practices. It helps move us from merely observing the problem to actively trying to disrupt it based on evidence.
Which brings us to a final thought for you, listening out there. For all of us, really. If violence is indeed preventable, much like we approach preventing a disease, what role do you play? What role do we all play in fostering community health and safety, not just in times of crisis, but in that ongoing daily effort to build peace, to build opportunity right here in our cities? Something to think about.